All right, y'all. Good evening. Yours truly, Dr. Barry. We are going to be talking about a great conversation today. I was able to mix some sports and the medicine talk, which is something I love to do anytime I get a chance to talk about some football, especially college football. Go Noles. I want to make sure we establish that very early. Go Noles. Anytime we get to talk about some football as well as some medicine, I'm all here for it. I'm going to be talking about Deion Sanders, right? Who, if you don't not know, let's say you don't know, who guess which college he's an alumni of. That is correct. Florida State University. He's probably maybe top 2, top 3 cornerback, depending on when you're talking to as far as the NFL is concerned. Former Jackson State college football coach, currently the Colorado, I don't even know what they call them, football coach, because it's all about Florida State right now. But he had some medical issues, right? He had some medical issues that was plaguing him, that's been plaguing him since the Jackson State days. But as you can see from the title, came to a head to the point where I was seeing a discussion. It's always funny. Let me just sidebar right quick. It's always funny when I see like people are shocked that the term stat in the hospital doesn't really happen fast. And then on the other side, when I see people talk about, emergent surgery scheduled for 2 days later, right? Those terms just don't match. As well as when people say, oh, the person's in a coma, and you kind of like, are they in a coma or are they just sedated medically, right? But I just know that's kind of a, inside out thing, right? When you're inside, you know the terminology. When you're not inside, you kind of say what's normal, right? But we're going to be talking about Deion Sanders, right? So he had to go, again, I'm going to put it in quotation marks. I don't want to put in quotation marks because, I don't want to belittle it, right? But, he had to have emergent surgery, right, to get these blood clots taken care of, right? And you're asking yourself, all right, why did he have to get blood clots taken care of, right? So we're not aware of the initial origin of the blood clots. Like, we don't know when they first came about. But what we do know is that this is something that has been dealing with for years, and it got to the point where you needed surgery, right? So we're going to talk about just DVTs in general. What are they? What's the causes, right? And how did he get to the point that he probably had one of the more severe complications of a DVT? Like, that's going to be our discussion today, from that perspective, right? Like I said, we're going to talk a little football, but more importantly, get our medicine on, and then we'll just answer questions that you may have like throughout the day. So Deion Sanders, right? We're talking about the DVT, right? So he had emergency blood clots, right? So essentially, doctors had to go in and physically remove clots that were in his legs. And why did they have to do that? For something that we know of as PTS, right? For post-thrombotic syndrome. Because you can have blood clots in the legs. And I can tell you the typical way we treat blood clots in the legs is we give patients blood thinners, right? You heard them before. We don't got to say their names. Why? Because, they cut me a check anyway, so we're not going to say their brand names, right? But there are blood thinner medications that you can be on to not necessarily, I want to make sure I clarify this, and I usually have to clarify this for my patients. When I put you on a blood thinner medication, I'm not putting you on that blood thinner medication to break up the clot. No, I'm not doing that. I'm putting you on a blood thinner medication to make sure that your body doesn't keep producing clots while your body is going to work on the clot. And this is something I always have to educate my patients, or just patients who come in the hospital, that when you get a blood clot, right? When you get a blood clot, your body's going to break it down. But the problem is that once you have one clot, your body says, oh no, there's this clot here. We need to do something about it. And then it does something that, causes, let's say, I'll break it down in layman's terms. It's going to sell cells. It's going to send signals to the body, say, hey, something's going on over there. Try to attack it. But in doing so, it actually makes you more susceptible to developing more clots. So then people like me have to come in and say, hey, you know what? This is what we're going to do. We're going to give your body medication that won't allow you to keep producing clots while your body says, you know what, let me break down that clot. Now, this is not a fast process. Again, Deion Sanders has been dealing with this for years. This is not a fast process. This is a process that takes some time. Usually, I tell my patients about 3 to 6 months. Usually 3 to 6 months for your body to break it down. But while it's breaking down, if you're on a blood thinner, you don't have to worry about it. But of course, in Deion's case, he had to worry about it because it caused us problems, right? So let's answer some questions. I see some people ask that eloquence is definitely one of them. We got someone says, so you got the vaccine then, right? And this let's highlight this, right? Because again, you know what we like to do, right? We like to highlight people who are uninformed on my channel. If you have never came across any of my lives, we love to do it. This is something that we go towards highlighting the uninformed, right? So his insinuation is that Deion developed clots because he got the vaccine. Guess what, ladies and gentlemen? Guess what disease puts you at a high risk for developing blood clots in the legs, blood clots in the lungs? Let's guess it, right? It starts with a C. Guess what? There's a vaccine for this disease that starts with a C. Guess what? The risk of developing a clot is almost 10 to 20 times higher if you have the disease versus having said vaccine, right? You guessed it, COVID-19, right? But anti-vaxxers will have you believe that the vaccine is the boogeyman in this case and not the actual disease. So I'm glad we got able to highlight that idiot, and then keep it moving, right? So someone says, let's see here. Can we get someone with an MD in here? I don't know if there's any MDs in here, but tag them if you can. Yes, I've been through this before. Yes, MJ says they definitely been. And again, this is not an uncommon phenomena. Dealing with blood clots is not an uncommon phenomena. Like I said, I take care of patients all the time with it, right? To the point where it doesn't even like, oh, you got blood clot? Okay, cool, right? But when you get to the point where Deion was at, where you have what again we call post-thrombotic syndrome, where now this blood clot is so significant that I have to do something surgical to get that blood clot out of there, then it's a must, right? Let me see. Someone's asked, go to the next question before we start. What kind of doctor are you? I'm an internist and a hospitalist physician. And for those who may not know what internist is, that means I essentially, the way I tell my patients is I specialize in the internal organs of the body, right? I don't have a specific specialty, right? Like cardiology, gastroenterology, pulmonology, endocrinology. I don't have a specific one. I just kind of focus on them in general, which makes it great because then I can touch on so many different points because I have to be aware of all of those points. But yeah, thank you for the question. Does baby aspirin help with prevent clotting? So this is a very good question. And I wish my surgeon friends were on the call, right? So does baby aspirin help prevent clotting? Now, let me tell you, surgeons, right? And again, I'm not bad-mouthing them. They'll tell you themselves. Surgeons hate blood thinner medications. Like someone mentioned, Eliquis, Pradaxa, Xarelto. Like they hate them, right? Because it could possibly mess up their surgery, cause problems with their surgery. If a patient needs to go to surgery and you're on any of those medications, guess what? You have to stop the medication. Surgeons hate blood thinner medications to the point where there have been studies that have shown that because what happens is post-operatively, after you have an operation, you are at a very high risk for developing a blood clot. Now, because we know this, we used to put patients on blood thinner like, hey, let me just protect you from getting a blood clot since you just had surgery and maybe you're not going to be mobile and whatnot. But the surgeons hate it so much that they did studies on their own. Again, a shout out to my surgeons, especially my orthopedic surgeons, where they looked and seen, hey, you know what? We can get away with giving patients baby aspirin twice a day, usually for about 4 to 6 weeks, and avoid having to give the Eliquis, right? Because there always fears like, man, if I have to go and do some type of surgery after the surgery quickly, I have to wait because you got my patient on the blood thinner. They hate doing it, right? So does baby aspirin help prevent clotting? In some cases, it works extremely well because when I talked about that process of your body sending, the cells out to kind of investigate, aspirin helps where when those cells go out, they don't clump together. Aspirin does a very good job at that. So your surgeons love using aspirin, especially for the preventative aspect of developing clots. Now, if you have the clot, like if the ship has already sailed and you have that clot, you're not using aspirin. Get aspirin up out of there, right? This is when you start using those brand name medications for sure. Let's see. Make sure we don't miss everything. All right. Okay. So all right. So I will. That'll make fun of him. Yeah, we like to make fun of people who are uninformed. No. This is a good question. Let's highlight Tony real quick, right? Because again, Tony says being skeptical of the vaccine doesn't make you idiot. No, right? But saying something like, "Oh, this person developed a blood clot and must have been a vaccine," makes you the idiot. Hope we got that. Hopefully we got that clarified. Yeah, you could be concerned about a vaccine for reasons to be concerned about. Blood clots is not one of them, right? If you're concerned about blood clots, you should be concerned about the disease. This is the step that those who are concerned about the vaccine typically continue to miss. If you are so concerned about blood clots, then you should be afraid of the disease. You shouldn't be afraid of the vaccine, right? You should be afraid of said disease. But for some reason, those who are so concerned about blood clots and want to pin it on the vaccine keep skipping over the fact that the disease causes blood clots at a significant rate. It's not even close. It's not even like neck and neck. Significant rate, right? So that's what we tell the people, right? If you're concerned about the vaccines, all right, give me your reason for being concerned about a vaccine. But you should be definitely afraid of disease if that's the case there. Let's see here. Christina says, my husband just died of pulmonary embolism. This is not a, and again, and we talked about, we're talking about DVTs and we're going to talk about Deion Sanders. A DVT is not a benign issue, right? Having a DVT, which is a deep vein thrombosis, which essentially is a clot in the venous system of your body, it can happen. A lot of times we hear about it in the legs, but it can happen in the arms as well. Very common to happen in the arms, especially if you have any IVs that are in the arms. But it's not a benign issue, right? It's something that we have to be very wary of. In fact, if you do a Google search for a DVT and a lawsuit, right? There's a whole bunch of lawyers that are going to pop up, right? It's not something you want to miss, right? And one of the complications, we talk about Deion with post-thrombotic syndrome, aka cutting off the blood flow to the extremities. But a PE, which is a pulmonary embolism, meaning essentially is a blood clot that has traveled through the venous system and got essentially stuck in the pulmonary system, making you have a terrible way of oxygenation, and you can pass away. You can pass away very quickly. So, sorry for your loss, Christina. Hey, how's it going? Shout out to my, I think this is Moderna Mafia, one of my Moderna Mafia followers. For those that know, she got her second bivalent booster, no clots, right? Yeah, because like I said, it's again the people again. I'm good for having an honest conversation. If you're worried about clots, yes, you should be definitely worried about clots. Now let's talk about this disease that we know causes clots through the wazoo. Let's talk about the disease called COVID. They never want to talk about it. They only want to talk about it in reference to the vaccine, which again makes zero sense in the world. No, let's see. Someone said prime time then trick the bus, right? We can have a whole conversation on Colorado in their season this year, but it's going to be, it's too funny. So James says, what kind of surgery? Not every surgery. I'm not sure if you're asking what type of surgery he likely had or what type of surgery you could use aspirin for preventing blood clots. But typically, the surgery for preventing blood clots, typically a lot of the orthopedics will use that. A lot of orthopedic doctors, especially when they do hips and knees, will do that. Now, I don't say all, but some of them do. If you're asking what type of surgery Deion had, he likely had what we call an angioplasty, which essentially is you go into the vessel, again, this is specialized stuff. You go into the vessel and you break up the clot there, or sometimes you go in there and you snatch it out, right? Like that can happen as well too, right? And it may seem like foreign, but when patients have a heart attack, the interventional cardiologist can go inside the arteries of the heart and suck out clots as well. So it's that same kind of premise from that perspective there. Well, let's see here. Someone said, what's the major signs of a blood clot? Very good question. So when we talk about the blood clot, a lot of times there isn't any. A lot of times there is no signs that you have the blood clot until it gets progressive. And when it gets progressive, one of the more common things, especially for any of my pre-meds, med students may hop on, is they complain of leg swelling. Like, my calf is swollen, right? My calf is bigger. My calf is a little bit tender. And that's when the clot is getting so big that it's starting to cut off a little bit of blood flow, and then you can kind of see it. So whenever, and usually we're all in medicine, we're all about getting a good history. I had a doctor, my attending physician would always tell me that you can run 1 million tests, get 1 million lab results, but if you take a great history and physical, you'll likely get your answer 80 to 90% of the time. So from a medicine perspective, questions I'm asking are, hey, have you had any recent travel? Have you had it, which would cause you to be sedentary for a long period of time? When I say long period of time, I'm talking like 4 to 6 hours, usually a pretty long time. Not like you went down the street or you went and got in your car, you drove for about 30 minutes to an hour, like usually a long period of time from that perspective there. I'm asking questions like, hey, have you had any surgery? Right? Like, have you had any surgery? Because we know surgery can put you at risk for getting a blood clot. Have you had any IVs or anything that foreign objects that were in your vessels that may cause you to be at risk for having blood clot? We do know that there are certain disease processes, especially when we talk about autoimmune disease, cancer, that can put you, COVID, that can put you at an increased risk for developing blood clot. So a lot of it is just kind of historical information, trying to figure out, okay, where does this person lie? And then when we're trying to diagnose it, usually the quickest is an ultrasound. Shout out to my radiology techs and my radiologists, right? They do an ultrasound, and a radiologist, especially my radiologist techs, they're great. For those that don't know, radiologist techs, they're amazing. They can actually do an ultrasound, see how the blood flow is, see how the venous veins are, and so they can do the arterial side too, but we're talking about venous DVTs right now. See how that goes, and then see like, oh yeah, blood clots right there. Like they're just that good from that perspective, right? So that's typically the presentation that someone's going to come into your office or go to the hospital for. Christina, again, rest in peace to her husband, talked about a blood clot in the lungs, right? Pulmonary embolism, acutely short of breath, chest pain, chest discomfort. Typically your heart rate is racing because if the blood clot is massive enough in the lung, it can actually cause strain to the heart. So those are just kind of telltale signs that we typically look for when we have to put a DVT or even worse, a PE at the front of our brain, right? So when we talk about Deion has been dealing with this issue for quite some time. So again, since he's been at Jackson State, he's been talking about it. And if you guys know Deion or watch him, he's been in the cane. He's had type of surgeries before, right? So he's been at risk. And again, I don't know what Deion's medical history is. I don't know, I don't know if he's a diabetic. I don't know what his medical history is, but we like I said, we just have to kind of deal with what we know, right? We know that, yes, he's had the blood clots. Most likely he was on blood thinner medications, because some may be asking, well, if he had these blood clots before, why didn't they just do the surgery before? And it's because typically when you have a blood clot, medicine is good enough, right? Typically medicine is good enough to treat it. And again, when we say treat it, we're treating it to make sure you don't develop any more blood clots while your body breaks it down. But you do run into a case where if you have a significant amount of burden from the blood clot, guess what? Like, I got to go in there and do something else, right? Because our Eliquises of the world, our Xareltos of the world, the Pradaxis of the world, they don't break up the clot. And you may need a medication that goes in there and actually breaks up the clot, right? We have medications for that as well, too. We use it a lot for our stroke patients, where if you have a stroke, and remember, when we think about clotting, just clotting in general, it's called different things depending on the system that's affected, right? If I have a clot in the venous system in the leg, it is a DVT. If I have a clot in my heart, guess what? I might be having a heart attack. If I have a clot in my brain, guess what? I'm having a stroke, right? But a lot of it is clot, clot, clot. A lot of it is just kind of that process of clot and then lack of blood flow, right? That is how it follows, right? So you have, again, Deion, who had clot in the legs. And I have to assume, like I said, we're just assuming here, right? We don't know Deion's medical history. There's no HIPAA violation right here. I'm just looking from afar, right? I'm an internist, hospital physician. I do this, right? So I'm just looking from afar. Oh, yeah, Deion's probably had been on some type of blood thinner for quite some time. Oh, he travels a lot as well too. He's probably had surgery. He's probably had injuries. We don't know what led him to get the clot in the first place, but he has it, and he was getting treated. And they were hoping that conservative therapy, which is, again, the medication, would be enough where he didn't need any problems. But what Deion kind of mentioned in this article, and, I suggest you Google it if you want. What he kind of mentioned is the fact that he was having increasing pain, increasing discomfort in his legs, right? And again, that's that telltale sign that, hey, this clot is becoming such a problem that now blood flow is being affected. Like, that's what happens. This clot is becoming such a problem that now it's affecting the blood flow. And if it's affecting blood flow, all right, we got to do something different, right? And that's where the sudden surgery typically comes in at from that perspective there. All right, let's see, make sure we're not. Let's get around to the questions again. Yes, shout out to the text. Let's see here. I want to make sure we don't. James came back and said, you said surgery causes clot. Yes. So the act of having surgery puts you at an increase for having a clot. Just that act of having the surgery, right? And when we're doing our history and we're asking our questions, one of our questions is, have you had surgery recently? And I mean gallbladder taken out, ankle fracture repaired, hip replaced, whatever. Have you had blank surgery recently? Because the type of surgery doesn't matter in terms of like, oh, this surgery puts you at a much higher increased risk for blood clots than that one. Like, so that for us doesn't really matter. Like, I don't care if you had a hip done, your ankles done. I don't care if they took your gallbladder out. I don't care if they took your ovaries out. Doesn't matter to me. If you had surgery, I have to start thinking like, oh, let me make sure that I get, because like I said, if you do DVT and lawyers, a whole bunch of people pull up on Google. Let me make sure one of those people don't call me. Right, I'm gonna clear myself, so make sure one of those law people don't call me because I missed the DVT in you. Because I missed the DVT in you, and guess what? Complications, can come around. So definitely, it's not a specific surgery that we are looking for. It's just that all surgeries play a factor to it. Oh, sure. Let's see here. Oh, this is a good one too. Pregnancy, right? Her daughter Robin had clots during pregnancy. I hope she's doing well. And this just reminds me of a very sad story. Very sad story. So I was a first year medical student going to second year, and one of our classmates, rest in peace, one of our classmates was pregnant, and she was pregnant. We went on a mission trip. We had a great time in the mission trip. Again, travel. We flew. Great time in mission trip, came back, and several weeks later, developed acuteness, shortness of breath, and ended up passing away. She had a massive pulmonary embolism, right? Which again, and so she had risk factors like, because I totally forgot, being pregnant puts you at increase for developing clots, right? So she was pregnant, she had a long flight, so she had a couple different things that added to her risk. And again, just because you're pregnant, no one's putting you on blood thinner medication, right? Just because you're about to go fly on a plane, no one's putting you on blood thinner medication. It's just one of those things that we know that there is a risk if you happen to have some of these factors there, right? Yeah, that just remind me because of it. Yeah, we're talking about Deion here. Let's see. Someone said he walked away from Jackson State, big mistake. Yeah, and we'll cut in football. Yeah, I think again, shout out. Like I said, I'm a Florida. For those if you didn't catch earlier, I'm a Florida State fan, right? So I want the alumni of my favorite school, and I went to Florida State as well, to do well, right? But it's going to be a very uphill battle at Colorado. It's going to be a very uphill battle up there, especially in that Pac-12 where you already got USC, Oregon. It's going to be a very tough, humbling season for him for sure. Hopefully he does well in the end from that standpoint. So that's what we're going on. Yeah, we're just talking about Deion Sanders. He had recent surgery due to what I have to believe is likely post-thrombotic syndrome from blood clots in his legs. Let's see. Yeah. He won't be able to tap dance. Oh, you wild. We got some funny people here. Funny people. Feet swell very badly and I have to wear compression. Yep. So, and I can't see the damage to the vein. Oh, so Joe, and I missed your first message, Joe, but I think we have someone talked about how, he has to wear compression stockings and he was kind of developing the pain and discomfort dealing with DVTs, right? Because like I said, I think a lot of times in medicine, we throw out terms that, like, oh, just had a DVT. Oh, you just have high blood pressure. Oh, you just have high cholesterol. And, we don't really stress the severity of it. And Joe said it best, right? Especially this portion right here. He said, did damage to the veins in my calves. Because what typically happens, and again, y'all not here for a pathophys lecture, but what typically happens is that their venous system, the veins, send blood flow back to the heart, right? That's what it does. But if you have a clot there, right, now those vessels can't do that. So just imagine I got so much pressure above me, right, trying to push blood flow back, but that clot is right there and it's not allowing me to do it. And essentially what typically occurs is that you have breakdown of these veins, and that's how you get the swelling, right? Because now all of a sudden blood flow that normally pulls from the feet go back up to the heart can't go nowhere. So it just kind of sits there. Then you get that swelling occur. And unfortunately, there's no way to reverse it. Right? Especially when it's done its thing, there's really no way to, even after your body breaks down the clot. So even when the clot is gone, the damage is already done. So that's what Joe is kind of mentioning as far as the damage to his veins from that perspective there. MJ says she had to go to the hospital. Whole lung was occluded. Yes. No, it's severe. It is severe, right? Again, I think a lot of times, the onus of DVT gets pushed on to the fact that it can cause a PE, a pulmonary embolism, right? So the deep vein thrombosis, when we talk about it in the way we talk about it, we're always scared that it can cause, and let me show you. If you go to the hospital right now, you get diagnosed for a DVT, they are scanning your lungs. You are not leaving that building without someone scanning your lungs because, again, like I said, DVT lawyer, boop, a million people pop up. They don't want that. So if they diagnose you with a DVT, regardless of what and how you got a DVT, we are going to check your lungs because we want to see, has that DVT moved up and, kind of did a stop at your lungs, right? We're going to make sure that's not the case because, again, just because you have the DVT and you have the PE doesn't mean you definitely need surgery, but, we're going to make sure that that's not the case for sure. So, and that's always the most fatal aspect of a DVT is that it can go up to the lungs. Now, not to say that what the surgery Deion had, he could avoid it. Because if he's telling me that he's having less blood flow, more pain, and we already know he has significant clot burden, we're doing surgery as well because guess what can happen? You can have an amputation. So imagine losing your foot and your leg because of a DVT, a blood clot. You don't want that to happen. Nobody else wants that to happen. Surgery has to go, right? So that's why he had to have the emergency surgery to get that done. Yes, Stacey, he is back at practice. Deion. If we know Deion, especially if you follow Deion, we knew that he was not going to allow that surgery to stop him from getting into work. And because I know Deion, I don't know him, but I follow him because he was Florida State and he went to my favorite team, San Francisco 49ers, right? So I've been following him forever, right? Must be the money, right? Depending on how old you are, that's a good reference. If you're young, you don't even know that reference, which is crazy to me, but hey, I got gray hairs for a reason. Yeah, like Deion's going to not only be at practice, but he's going to use the surgery as motivation to get those kids to work, right? Like I said, I'm hoping Deion does good this year. I looked at that schedule; it just don't look like he will, from that standpoint. As we said, I had a knee replacement and I had a risk for a blood clot. Yeah, so anytime you've had a surgery, your risk, and now let me say this. Now, typically, especially when we talk about the surgeries, usually there's a time frame. Like if you had a knee replacement 10 years ago, I'm not going to say that, all right, that's going to make you at an increased risk for getting it. But if you had a knee replacement 6 months ago, and now you're telling me your leg is swollen, your leg is pain, all right, boom, boom, I'm blaming the knee surgery. So there is like a time. Now, there's no exact science to it. But if you had knee surgery 10 years ago, I'm not necessarily blaming that knee surgery for you having a blood clot today. Right? That's usually the case here. But it always is a concern anytime you have any type of surgery, for sure. Let's see here. So Keith, I like Keish, right? So Keish asked she says a very good thing, right? Deion's issues are with his arteries, right? Circulation, clog, narrowing of the arteries. And the reason why that's important, now mind you, I had my hat on, my conspiracy hat on, because of course the media and everything else is talking blood clot. You don't typically get blood clots in the arterial system. The pressure is too high there. But you typically don't need surgery for the venous system. You typically don't. Now, again, like I said, there is those cases where the venous system can get so blocked up that is causing poor blood flow and is causing surgery. So there is that case there. But typically, especially because they were talking like, oh, he needs amputation. When we talk about amputation is usually the arterial side, right? So shout out to Kesh, I'm not sure if I'm pronouncing it right. It's usually that side. So that's usually the concern. I was concerned with you. I was like, oh, is this an artery issue? Because ain't clots in the world going to save you if you be at bad arteries. So that's why I'm hoping it's the venous system. I'm hoping it's they're able to kind of, again, remove the clots, get that blood flowing accordingly. Because if it's the arterial system, that's a whole nother discussion, right? Peripheral arterial disease and the risk factors associated with peripheral arterial disease could literally be a whole separate lecture. Y'all not on TikTok to hear lectures, but like it could be, that's what I do. But that could be a whole separate lecture. So I was definitely with Keish or Kesh. I'm not sure if I pronounced it correctly. And thinking that like, oh, this might be the arterial system. But at least from what they're telling us, again, like I said, we don't know the business, but from what they're telling us, the concern likely is on the venous side from that standpoint there. Someone said they had hypertensive encephalopathy. Can I give some info? Oh yeah, we could do it quickly. So hypertensive encephalopathy, right? So there's two words, right? There is hypertensive, aka your blood pressure significantly elevated, and encephalopathy. Encephalopathy is a very cool way for us to say altered mental status. It's a very cool way to say altered mental status. So in plain terms, your mother-in-law had uncontrolled blood pressure that caused her to be confused. Uncontrolled blood pressure caused her to be confused, right? And the reason why, because if let's say I'm hoping all of our blood pressures are normal on this chat. I'm hoping y'all go to your local Publixes, CVS's. You're actually checking your blood pressure, right? I'm hoping y'all do that. I'm hoping y'all not just walking by it and then walking around this world out here not knowing if you have high blood pressure or not, because that could be a whole if you go to my YouTube page or my website, I talk about hypertension all the time, right? It could be a problem. But the problem is that when your body cannot deal with the amount of blood pressure, let's say it goes from 140 up to 200, you start getting confused because you would think like, oh, my pressure is high. But when your pressure is high, guess what? You actually have less blood flow to the areas, right? Less blood flow to the areas of the brain. Your brain starts acting very confused and it starts becoming a very high risk for stroke. Right. So that's essentially what happened. Uncontrolled blood pressure causing confusion, aka encephalopathy in that regard. So it's extremely important. She has to be very mindful of her blood pressure. And because hypertension is typically a genetic factor, people who are related to her need to make sure they're checking their blood pressures as well. Let's see here. Yeah, someone said that he pretty sure he lost a blood clot, head toe to a blood clot as well. Yeah, because he's had, and that's the thing, and that's why when I talk about kesh or a kishish, that's why I think it was arterial, because typically, if you're losing toes, if they're cutting, because they did cut, I forget how many toes, but if you're losing toes, that's usually an arterial issue. They threw me off when they said he had to have these blood clots removed, right? But usually poor circulation in the arterial side will cause amputations in the toes. And guess what? We kind of mentioned it. Guess what the number one, number two causes in the world for amputation, especially here in this country? Well, definitely in this country for sure. Hypertension, diabetes, right? Hypertension, diabetes. Those are the top two diseases that can lead you to have peripheral arterial disease, which can cause amputations, right? So again, but when he said blood clots, I said, okay, Deion, I'm going to rock with you. But I was definitely, like I said, I was definitely with Kish thinking that this was an arterial issue, not venous. Chris Jones says, my dad died from a PE. He wouldn't go to the hospital until he started coughing up blood. Yeah, no, the burden of the clot, and especially again, and guys, it's not like it's like a huge clot like the size of my fist going on, but the problem is that when it affects the arterial system, guess what? The brain does the same thing. Brain says, hey, there's something going on with the lung, go investigate. And in its investigation, guess what? That clot burden gets bigger, which means more of the area of your lung gets affected, and it essentially causes heart strain. So that is definitely not an uncommon sequelae of chest pain, chest discomfort, hemoptysis, aka coughing up blood from a significant PE. Again, rest in peace, Chris, to your father, but that's definitely a complication for sure. Someone said I can ignore it all you want. I'm not sure what they want me to ignore. This is a good question, right? So this is a D dimer. Okay. All right. Let's talk about the D dimer. Now, this is just more medical stuff, right? So someone said, how accurate is a D dimer test? So more importantly, what is a D dimer test, right? A D dimer test is a very cheap laboratory test we do in the hospital. We do it all the time. When we have a concern that a patient may have a blood clot in the lungs. The problem, right? This is more of a biostats issue, right? The D dimer is a very sensitive test, but it's not specific, right? Again, and I have a master's of public health too, right? Stats, folks, you know exactly what I mean, right? This test is very sensitive, meaning that if it's elevated, yeah, there's a concern that you may have a blood clot, but there's also a concern that you can have a whole bunch of other things. And the reason why is because it's not very specific. Right? Very sensitive, but not very specific. We want a test that is very sensitive and specific. Like if that test is positive, that means you have a blood clot in the lungs, right? That's when they typically do the CT angio, because that is a test that is sensitive and specific. The D dimer, it's our cheap little test. They say, hey, let me just throw the test out here. Because if that D dimer is negative, it's a great predictive value that you likely don't have a clot. Because we know anything can kind of raise that D dimer to go up. So if you had a negative D dimer, the likelihood that you have a blood clot in the lung is extremely low, right? Not zero, right? Because again, remember, DVT lawyer, a whole bunch of people pop up, right? So it's not zero, but with confidence, you could be like, you know what? Clinically, I didn't think this person had a clot anyways. Now this D dimer kind of confirmed it. You can kind of, in your notes, you can kind of write enough to say, if one of those lawyers pull you up, you say, hey, well, Dr. Pierre, how come you didn't do the CT angio? Well, this patient was breathing fine. Oxygen was 100%. The heart rate was normal and the D dimer is negative. So you had a lot more clinical evidence to say they likely don't have a clot, didn't have a clot, right? So that's the D dimer. Very sensitive test, but not very specific, which is a test that a lot of my attendings don't even like ordering because of all the things that could cause an elevated D dimer. We still got people talking about the vaccine. Too funny. For the fun part of having POTS is that half the symptoms, the fun part of having POTS is you have half the symptoms for everything at any given moment. Yeah, POTS is, and that's something like I've been meaning to really do a deep dive, because I'm an internist, so I don't typically deal with a lot of patients who have POTS, or a lot of that is more my rheumatology colleagues. But the patients I do deal with say this all the time, right? Like if you ask them something, like if you're asking your series of questions during the history and physical, you get a lot of yeses. So you didn't have to say like, okay, all right. Like you're saying yes to everything, but for them, it really be true. Let's see here. Why are so many people getting blood clots? We're not actually seeing, outside of COVID, right? Like if we say pre-pandemic, you're not having increased risk of people getting blood clots. Post-pandemic, the risk is due to COVID, right? It's usually the unfortunate, right? Because of COVID being around, people getting repeat infections over and over again, you are at increased risk for developing clots, for sure. But very, very good question. Is heparin the best treatment for PE? So very good question. You guys are killing it today with the questions, right? So is heparin the best treatment? So typically, reason why we use heparin, one, is that we're saying, hey, you know what? I need something in your system ASAP. So heparin is an IV drip related medication that thins your blood. So heparin is one of these medications that if you walk into the hospital and I think you have a blood clot, or more importantly, let's say I diagnose you with a blood clot, I'm throwing you on heparin. But again, remember, I'm not throwing you on heparin to treat the PE. I'm throwing you on heparin to make sure that your body does not produce any more clots while we go to work. And when we say go to work, while we add different medications. So typically, by this time, we're old school. We used to have heparin and medication called Coumadin. We don't typically use Coumadin if we don't have to no more because of all of the risk factors and side effects. At this time, we're using Eliquis, Pradaxis, or also that's when those medications come about. But a lot of our docs will keep patients on heparin, especially if they have a PE. And if it's a significant PE, you may be on heparin drip for about 24, 48 hours because that doc wants to make sure your body doesn't produce any clots and it's kind of slowed that process down. Because the PE, the developing of the PE, developing of the DVT is this like accumulated process. It keeps on moving. So you have to pump the brakes on the body producing more clots until you get the right medication on there. So it's not a treatment, but it's more of the bridge to it, right? The treatment for a PE, especially from a drip formation, is actually called TPA, which is tissue plasmin activator or something like that. That's what we do for strokes. But if you have a significant enough PE, we will give you that medication at the clot to break it up, for sure. So definitely a very good question. Very good question. Yeah, factor V latent is definitely another risk factor for clots in and of itself. Let's make sure like I said, you guys have been doing great with the questions today. Very good, very good. Let's see here. Appreciate the stagnation. So I'm looking great today. Millie. Shout out to Millie. Millie says, who is this person? So Deion Sanders is a former alumni of Florida State. Go Noles. Who is again, this is him here, who is a former, he's probably the top two, probably, depending on who you're arguing with, top 2 or 3 cornerback in the NFL ever, right? So one of the best cornerbacks ever in college, one of the best, well, not necessarily college. We've had actually better college cornerbacks, but that's a whole different discussion. But definitely NFL, one of the 2 best NFL cornerbacks. He is the current coach of the Colorado Buffaloes, but he used to be a former coach for Jackson State, HBCU, and he had to have emergency surgery to get clots removed because he had very poor blood flow. Some of us, right, shout out to Kesh or Kish, thinks it may be due to the arterial side. Some of us think that, it's on the venous side. So lots of good conversations there for sure. Let's see. Jeff says we need to fix our diets. I agree. We always need to fix our diet. And that's the thing too. We always need to fix our diets. And I think that's the thing that's happened, especially with we're just sidebar to COVID. That I think a lot of people, want to believe that us healthcare providers, right, only want to make you take a vaccine, right? Like, we don't want you to exercise more. We don't want you to, sleep better. We don't want you to eat right. Like, they make it seem like we only want you to take the vaccine. That's not the case, right? We want you to do it all, right? For sure. Let's see here. Let's see. Yeah, like a lot of vaccine talk. Like I said, and Millie, we talked about this earlier, right? We had to talk about because we know, right? We know that a lot of people who are afraid of the vaccine, right? Want to believe that this vaccine is this big boogeyman, right? And I tell them, I say, hey, if you're concerned about clots, like if clots are really what you're concerned about, there's this disease called COVID-19 that puts you at increased risk for clots. Right. They don't never seem to make the leap to be worried about COVID-19, but because they're so fixated on the vaccine possibly causing clots from that perspective there. Oh, let's see. Make sure we're not missing anybody because y'all guys are moving. All right. I'm not sure about the two ties. He's still good. Yeah, he's coach. He's already back. He's already back. He was already back at practice. Deion is not. Deion's coaching the season. If we know Deion, and honestly, I feel like even if they had to amputate Deion's legs, he'd try to coach the season. Like, I just feel like that's Deion's mindset. He'd be on there with the wheeler, like trying to do it, right? Like, I think that's just, shout out to Prime. Let's see here. Make sure we don't miss anything out here. Like I said, you guys have been doing great job as far as the questions. Like I said, obviously we knew, right? I decided we should have known, but we should have known, this, even when we talk about this, people are going to bring up the vaccine because people love talking about the vaccine. They love it. Again, like I said, the vaccine is their boogeyman. The vaccine is their boogeyman. I can't help it. And again, like I said, I made a TikTok video. Again, a lot of y'all not scared of COVID enough. It's weird to me. I don't know why, but y'all not scared of COVID enough. Someone said, what are the first signs of toe loss or amputations? Usually pain and poor blood flow, discoloration of the toes due to diabetes. But like I said, it's diabetes, hypertension, both of those being uncontrolled, but even worse, you can be rocking diabetes and blood pressure for decades, and you still eventually get to the point where like your blood flow is poor and eventually possibly needing it, right? So it's not necessarily like, oh, the diabetes was out of control and that's why they got amputated. A lot of times, everything was rocking. They were taking their medication. They're doing everything they can, but just because of the way the disease works. And I tell people all the time, especially in diabetes is discussion, like a lot of times when we hear diabetes, we only focus on the blood sugar, right? But diabetes is a very, very vascular disease, right? It's a vascular disease through and through, right? When we talk about diabetes, I'll go my diabetes soapbox. Number one, number two cause for strokes. Number one or number two cause, depending on when you read it, for heart attacks. Worldwide, top three cause for blindness. Top three cause for putting patients on dialysis. Top three cause for patients needing amputation. This is diabetes. This is the sugar disease, right? So when you factor that the sugar disease causes all of these problems in erectile dysfunction, right? Shout out to the men, right? Erectile dysfunction. If your diabetes is uncontrolled, you will have erectile dysfunction. I want to stress that because whatever I could do. We just finished on the YouTube page. On our YouTube channel, we just finished the men's series for health. In fact, I think this week, what am I talking about this week? I think this week I even did a summary of the 10 different diseases. Let me make sure I have that correctly before I tell y'all a lie. But it's something like the 10, I forget what I titled it, but essentially it's like the 10 top diseases that men should be worried about. Yeah, the top 10 men's health issues that you should be worried about, right? So erectile dysfunction. I know sexual health is always a big one that can get y'all going and moving. Nancy is 2 courses away from graduate certificate in public health. Yeah, shout out to Team Public Health in the building. Let's see here. Someone says, too bad you can't sue pharmaceuticals. Yes, you can. I don't know where y'all got that lie of y'all can't sue these pharmaceuticals are getting sued all the time, right? All the time they're getting sued. You may not get the money that you think you're getting, but yeah, you can definitely sue them. This is a very good question, right? So, AB says, is flying after having a blood clot a bad idea? Typically, you want to make sure your doctors give you that clearance, especially if, let's say, you get diagnosed with blood clot on, Monday, and you got a flight on Friday. You want to kind of make sure the cardiologist or the hematologist kind of gives you that thumbs up to say it's okay. Because obviously, you're going to be, because you're not going to leave the hospital wherever you're at without the proper medications anyway. So yes, you'll be protected, but you just want to make sure you got good clearance from that perspective there. Let's see. My platelet count was 3. I have no idea what caused it. I'm not sure either. Blood thinner. This is what I got for new that. Yeah. AFib. That's a big one too. Atrial fibrillation definitely increases your risk. So again, atrial fibrillation will increase your risk for developing clots, and we know if it increases your risk for developing clots, we kind of know the sequelae. If you can get clots, you can get DVTs. If you get DVTs, you can get PEs, you can get a problem. So again, we're going to throw you on that blood thinner to make sure we stop that in the beginning. Let me see here. It says Hank Aaron, Jamie Foxx, D-Man's Prime, just name a few. I guess Vince is insinuating that all these people got vaccinated. Like, it's, what's so funny, right? Because I'm about to get off in a second, right? What's so funny about those who are scared of the vax, right? They're scared. I mean, they're like terrified of the vaccine. One, they won't acknowledge their fear, and they won't acknowledge that their fear comes from nowhere, right? Like, they have no scientific background to say what they fear. They done heard someone say it on a TV show or one of their favorite bloggers and said some dumb stuff, right? So then they come just repeating it, and they don't even realize how silly they sound repeating it, right? But again, this really is just fear. Like, and I understand, right? I understand if you've been fearful of the medical system, and like I said, medical system ain't a saint. I'm black, right? So the medical system ain't a saint. It's done the black folks, right, terrible harm since the beginning, right? So I understand if you got this irrational fear for it, right? Because it has a history of doing us bad. So if it has a history of doing us bad, I can understand why you may not trust it, right? But if you don't trust it, just say, hey, yeah, doc, I don't trust that, right? Don't get on here and say that, it causes clots to do this, because then you don't sound very smart. Right. There's one thing I don't want people, if I don't know something, I'm not going to say it. Right. Because I don't want people to assume that I ain't that smart. Right. But when I say stuff, right, and then I just kind of let it out, now I'm like, oh, yeah, he ain't that smart. Right. Like that's typically the case I hear. Let's see. Someone said COVID isn't scary. Yeah, like I said, this like person right here. He said COVID isn't scary. COVID, think about it. I haven't looked up these numbers. Let's see here. I haven't looked up the numbers in a while. It's been a while, especially once the states stopped reporting it. Then it's very difficult to get like accurate numbers. But typically we keep a nice little. The worldwide tracker is pretty good. Let's see how we're doing worldwide here. So here in the United States, we have 1.1 million people die. Right. So imagine, right? Like first of all, we've had a total of 691 million cases of COVID, right? People not scared of that. We've had 6.8 million people die. People not scared of that. Here in the United States, 107 million got COVID, number one. 1.1 million died, number one. They're not scared of that. They're scared of the boogeyman of the vaccine, right? These are the people we don't take serious, right? It just is. We don't take them serious, right? If you not now, mind you, 1.1 million. I want y'all, right? Do your homework, right? Because y'all are good at looking up stuff, right? I want y'all to look up how many deaths the flu caused in the past 10 decades. Remember, I said 10 decades. I want you to look up how many people has the flu, like just the flu we talk about every year, killed in the last 10 decades, and then I want you to tell me in comparison to that 1.1 million, right? But they're not afraid of that, right? They're afraid of the boogeyman of the vaccine, Right, too funny. I don't know any updates on Jamie Foxx. I think his family, will, rightfully so, has been very, kind of keeping it to themselves as far as what happened. I think, whenever Jamie, wants to let us know what went down, he'll let us know what went down. But I don't have anything from that perspective there. All right, before I go, let's highlight this, right? So as a person who writes the death certificate, right, or fills in the death certificate, right, this person says, my friend died. It's always a random person. My friend died in a motorcycle crash and they marked him dead by COVID, right? First of all, why would they do that? What? Let me show, and again, it's because I know y'all don't actually know nothing about death certificates or how they get filled out, that y'all can say that stuff and then y'all just hoping, right, that someone's not intelligent enough to say oh, this makes zero sense in the world, right? There is zero reason for a person who is in a motorcycle crash, right, to then become tested for COVID. And if they become tested for COVID, for someone like me to write number 1, COVID. There's zero reason. I'm going to put trauma, right? I'm going to put, there's zero reason. But again, because they don't know no better and they're afraid of the boogeyman, right? They're afraid of the boogeyman. They say it's got to be COVID, right? It's got to be, it's COVID. We're marketing everything as COVID because we somehow get paid for it, right? Too funny, right? All right. All right, that's the last one. We're not, we're not going to give him too much energy. We're not going to give him too much energy from that. So, all right, guys, I appreciate y'all. Y'all been great this week. Lots of great questions. If you have any topics that you think we should touch on, because typically we do this every Thursday evening. Like I said, today I saw this article. I said, let's talk about blood clots. We haven't talked about blood clots in a while. But if y'all want to talk about hypertension, high cholesterol, diabetes, whatever, I'll find an article that kind of highlights it, or we'll just kind of just shoot the breeze from there. But y'all be blessed. Y'all have a great evening. Stay safe, and remember, right? Right? Do not be afraid of the boogeyman of the COVID vaccine, right? If you're just afraid, just say you're afraid. It'll be much easier if you just say you're afraid. Y'all be blessed. Y'all talk to you. Oh, someone said hypertension? All right, we'll talk about hypertension next week. Talk to you later. Bye.